Thank you for the invitation to help launch the publication of the 4th Australian Atlas of Healthcare Variation. I would like to thank the Australian Commission on Safety and Quality in Healthcare and the Australian Institute for Health and Welfare for their development of this comprehensive report. Thank you also to the Safety and Quality Commission for your ongoing work to improve the safety and quality of healthcare for all Australians. The goal of the Atlas series of publications is to ensure that all Australians receive the best possible healthcare. The Atlas series provide a unique dataset and evidence to examine the Australian health system by exploring how healthcare use in Australia varies depending on where people live. This is the 4th Atlas the Commission has produced, and taken together, the series provides great insight into healthcare delivery in Australia. The 4th Atlas investigates reasons for variation that may be unwarranted and provides recommended actions to reduce unwarranted variation. Variation in healthcare delivery can be a good thing if it reflects health services that are responding to differences in patient preferences or underlying needs. However, when a difference in the use of healthcare services does not reflect these factors, it may represent an opportunity for the health system to improve. In this edition of the Atlas, the Commission examined 17 investigations and treatments provided in acute and primary care settings across 6 clinical themes. In each area, key findings and recommendations for improvement are outlined. It is important that all governments and healthcare providers take the time to consider the findings and recommendations contained in this publication. The Department of Health will carefully consider the report and all findings and recommendations in the coming months. For example, the Atlas has pointed to the need for change in preventable hospitalisation rates for people with chronic diseases. The Atlas reports that more than 330,000 potentially preventable hospitalisations in 2017-18 were due to 5 key chronic conditions, and trends show that these numbers are rising. These 5 conditions include chronic obstructive pulmonary disease, COPD, kidney infections and urinary tract infections, heart failure, cellulitis, and diabetes complications. The Atlas also reports the growing evidence that early planned birth of babies before 39 weeks, where there is not a medical or obstetric reason to do so, increases short and longer term risks for children. In response, the Atlas proposes changes to hospital policies and other aspects of our health system to encourage planned caesarean sections to happen after 39 weeks where it is safe to do so. By stimulating review of healthcare use and promoting appropriate care, the Atlas guides better use of our healthcare resources and better outcomes for patients. In the 4th Atlas, case studies reporting on action prompted by previous Atlas publications are included. For example, one case study discusses how the first Atlas showed that a particular area of Australia had higher than expected use of anxiety and depression medicines. The use levels were not justified by differences in the rates of anxiety and depression in the population. In response to these findings, further analysis of the Atlas findings were undertaken by the local health service, followed by a number of actions to improve the quality of clinical care. Thank you again for inviting me to be part of the launch of the 4th Atlas of Variation of Healthcare. As a healthcare professional and epidemiologist, I commend the work of the Safety and Quality Commission and the AIHW on this important publication. The 4th Atlas is a key resource to help the Safety and Quality Commission and all Australian governments to identify areas of concern and to work together to improve health outcomes. The Australian Government will consider all findings and recommendations, and I urge others to do the same. Thank you.